Hi, I'm Dr. Greg Grillo with Express Dentist, and I'm here to talk to you a little bit about mouth sores and a possible cause that you may not be aware of. There's a lot of people that deal with mouth sores or ulcers, also called aphthous ulcers. Now, these are different than the big sores that some people get on the outside of their lips, which are actually caused by a type of herpes virus, and they can be contagious as well. But aphthous ulcers are those sores inside your mouth, maybe on the side of your tongue, on your gums, on your cheeks, on the very inside of your lips. They usually look fairly irregular. There can be multiple ones. If you have them, you know exactly what I'm talking about. They can be very uncomfortable. Now, nobody really knows exactly why these occur, and there can be various causes, and sometimes it's very frustrating to figure out what is causing them. But one thing we know is once you get one of these little sores, they feel much bigger than they usually are, although some people can have sores that are the size of a quarter, for example. But once you get one of these, you're probably looking at about a 10 to 14 day course for it to completely heal. And oftentimes they get worse before they get better. So trying to identify causes is important, if at all possible. Now, one possible cause that is often overlooked is a common ingredient in toothpaste. It's called SLS, or sodium lauryl sulfate. What is this? SLS is in most commercial toothpaste, and it's what makes your toothpaste foam. Think of it a little bit like a soap or a surfactant. And why do they put this in our toothpaste? The same substance that makes other cleaners foam. Well, first of all, it does give us a sense that there's a cleaning action that takes place. Beyond that, it's difficult to say how necessary it is, but because it's a surfactant, it can help with the cleaning. There is some limited evidence on that, but there's also some decent evidence, and I've seen it many times in my patients, that SLS can cause mouth sores. And for some people, it's as simple as eliminating commercial type toothpaste and going to something that's SLS free. And you can find SLS free toothpaste. Now, they're not going to foam as much, so there could be the sensation that it's not cleaning as well, but most of these will work just fine if you're using a consistent technique and you're taking your time brushing the way that you should be a couple of times a day. But sometimes just by eliminating SLS, you will also eliminate mouth sores. And it is known that SLS it can in some people break down the surface of the tissue inside the mouth, and this is why that happens. So if you're struggling with mouth sores and you just have never been able to really figure out what's causing this problem, then do a trial. Just eliminate the regular toothpaste that you're using, buy one that's SLS free, that you can find them online, like at Amazon. Make sure it's a good one that has good reviews. Check the other ingredients as well, and just see what happens. Give it a little bit of time. So depending on what the frequency of your sores are, some people only get them once in a while. Some people are kind of dealing with them on a continuous cycle. But I would give yourself a good 90 days to just see if you can tell a difference and pay attention to what happens there. And it could be that that's the answer. And if not, then you might explore other possibilities. You know, some people are sensitive to spices, like cinnamon can be an example. And I have seen a few patients that just the mint flavoring in the toothpaste is enough to cause irritation in their tissue. Not always ulcers, but irritation. So this is one of those common causes of mouth sores that's often missed or overlooked. And so if you're dealing with it, give it a try and see what you think. At Express Dentist, we have a trusted network of dentists that you can reach out to us and we can put you in contact with them. So if you're dealing with mouth sores or ulcerations, mouth irritation, your tissue, anything like that, please be sure you get it evaluated as well. And we can put you in touch with someone in our network in your area. So feel free to give us a call, contact us, and we'll help you. All the best to you and your oral health.